Hello, I'm Dr. Amit Rauthan. I'm a consultant in Medical Oncology, Immunotherapy and Precision Oncology at Manipal Hospital, Old Airport Road, Bangalore. We're talking about liquid biopsies and circulating tumor DNA. Now, when we say liquid biopsy, what we mean, we are using blood or we are using some of the sources apart from a tissue biopsy, which may be a fluid source, and looking for circulating tumor DNA. Now, there are different ways and there are different types of testing, but as of now, when we do liquid biopsies, we take a blood sample and we send it for testing. Now, we look at tumor DNA in this, and then we look for certain mutations which may define the type of resistance happening in tumor cells. So, when do we do liquid biopsies? Normally in breast cancer, we have a tissue with us, so we biopsy the tissue and look for all the testing biomarkers. But sometimes, when patients are on treatment in the metastatic setting and when they progress, one can always look at blood and look for a liquid biopsy and test this biopsy for certain mutations like ESR1 mutation, PIK3 mutation, BRCA1 and 2 mutation, HER2 mutation, and these are all the tests which are available by doing a liquid biopsy test. The pros and cons, when we talk about liquid biopsy, it is the ease. You can just take a blood sample and send it for testing. The mutations which you find in blood, we know once they are there, they are always there, and you can always rely on these mutations which you find on a liquid biopsy. Also, sometimes there is something called as tumor cancer heterogeneity. When there are different cancers from the primary and from the metastatic site, in a liquid biopsy, we can always find out what is the dominant pathology, dominant mutations, and that can also be used in the clinical setting. The cons of a liquid biopsy, sometimes there is something called as tumor shedding, which is very low, and we may not pick up a mutation in the liquid biopsy. And if we don't pick up a mutation in a liquid biopsy, we always say, don't go by that report alone, do a tissue biopsy also and look for the mutation in a tissue biopsy. But definitely, liquid biopsy is again changing the way we think about cancers. It is quick, it is accessible, it is easy to do, and it also tells us about heterogeneity. So we are using liquid biopsies in these settings for breast cancer patients.